Hello and welcome back to the MSC YouTube Studio. My name is Charity Ekezie, and joining me is Dr. José Manuel Barroso, the chair of the board for Gavi, the Vaccine and Alliance, and the former president of the European Commission. Thank you for joining me today, sir.
My pleasure.
You're welcome to the studio. So I want to ask you about Gavi. Now, what's Gavi's commitment to pandemic preparedness in Africa?
So we are preparing for next pandemic in Africa or elsewhere. But it's true that there is a special concern with Africa. In fact, most of the countries in which we operate are African countries. And we know that there has been a problem of inequity. Even during COVID, there were less vaccines distributed in Africa than in the richer countries in the world. So we have created, for instance, now some capability, financing for some African capability to manufacture vaccines in the continent. It was launched, the African Vaccine Manufacturing Accelerator, that's the name, in our conference in Paris last year, with the presence of President Macron and several African presidents. So with $1 billion US dollars to commit at the beginning, so that Africa can also develop its own capabilities in the manufacturing of vaccines. But besides that, we are, of course, working for general preparedness, be it in Africa, be it in the Latin America, Asia, or also in Europe, because we need also to have this global vision. As I usually say, the virus does not need a visa to travel, and the virus does not respect the borders. So, and that's very important to understand. The commitment to support our organization, to support vaccination, is not just an act of solidarity, which is, of course, important, or humanitarian responsibility, which, of course, is a good thing to do, but it's also about health security. Nobody is safe until everyone is safe. That was a mantra during the COVID, and it's true. So that's why we are asking the richer countries, our donors, to keep their generosity so that we can have to invest in this pandemic preparedness, having sufficient resources for the next time there is a pandemic, we can intervene immediately. This time we were not able to do that because, in fact, there was not that funds. So so that's why the richer countries, they, of course, they have deep pockets. They could find financing for buying their own vaccines. At the beginning, some of them, they were buying 4 or 5 times more vaccines they needed because they were not yet sure which vaccines could really be effective. So they were buying, but those who were not having the same resources, they were expecting the global solidarity. That's what we have done. Gavi, we created COVAX with other organizations so that we could have access to more resources, so that we could buy vaccines and distribute them to the most vulnerable countries. But it took some time. Not so much as in the past, but it still took some time. We hope that next time we are ready to do that. In fact, now with Mpox, it already happened. With Mpox, we were more prepared. It was not so big, of course, a challenge as COVID, but it happened mainly in Africa, not exclusively, but mainly in Africa. And because we already have some reserve funds now, that was one lesson of COVID, it was possible for us to make the procurement in record time. It took some days only. So that was a good lesson that we learned from COVID. And I hope that our donors will keep their commitments and will support this effort.
Wonderful. So what are the main challenges and opportunities in increasing vaccine coverage in Africa and beyond? And how can the international organizations like Gavi support these efforts?
Look, the challenges are clear. It's we are now seeing many diseases. Some of them, by the way, aggravated because of climate change. That's quite clear. That's scientific proven. For instance, more dengue. Not only in Africa, in Brazil. I was just now in Brazil. So we see dengue, we see cholera, malaria that have some connection with the rising temperatures that are becoming more acute and more widespread. So this is certainly a challenge. There is another challenge, to be very open with you, is that the donor countries now, because of problems with their budgets, fiscal constraints, they are becoming more, let's put it, selective when it comes to supporting the developing world. So, and that's very important. So the opportunities are also there because, first of all, as I said, it's a matter of justice, but it's also a matter of security. We are here in the Munich Security Conference when we are speaking. Security is not just about military security. Of course, it's important to be sure that our borders are not going to be violated. But it's also about human security in the broader sense. It's also about health security. So what we are trying to make the point is, let's invest in security in general for our citizens, and namely for our children. There is nothing more important than to save the life of millions of children. By the way, according to the estimates, thanks to Gavi, we have avoided at least 18 million deaths since our creation, because we can measure that. Countries that were able to vaccinate children and countries that were not able, and we can make the comparison. So we have already contributed to vaccinate more than 1 billion. And in fact, the latest figure is 1.1 billion people, most of them in Africa, but also in the so-called global south. Thanks to that, we have avoided the deaths of many people. So I think this is, of course, an opportunity for those who want to do good. And for that, I hope not only the governments, the richest countries, but also the private sector, some philanthropies that can also help us in that fight against death and against disease.
Wonderful. So let's talk about HIV/AIDS. We see what's going on in the news right now. A lot of funding being cut off from Africans and some African countries, and I guess countries all over the world, to be able to, provide the medication required for those with HIV/AIDS. So what is Gavi's role in achieving a world free of AIDS?
That is not really our mission directly. So we have a global fund that does that. And by the way, they are doing very well. They are a sister organization and we very much work together. But in fact, we are on the other, we are in the vaccines world, not specifically on HIV/AIDS. But we are supporting those efforts, of course. As I said, it's a sister organization. By the way, we are in the same building in the Geneva Public Health Campus and very much cooperating with them. Having said that, coming back to your question, we are concerned. I have to be very honest. We are concerned with the attempts to reduce the financing for aid in this sector, for the reasons I already mentioned.
Yeah, thank you very much, sir. So what lessons from your political career can be applied to enhance global health?
Look, to be very honest with you, when I was invited to be a candidate for this function, it was in 2020, I was surprised because I had no previous experience of vaccines or immunology. So I say, why are you asking me to do that? And they said, no, you have some experience in development, because I was very young, deputy foreign minister and responsible for development cooperation in my country, but I was also afterwards foreign minister dealing with development issues. But basically they said it's because having been the president of the European Commission, you are used to deal with a great variety of interests and multicultural, multinational interests. And Gavi is a multi-global, a multinational organization with the so-called donor countries, with the developing countries, with the industry, the pharmaceutical companies from the north, the global north, from the global south. So we have a great coalition, if you want. It's a public-private partnership. So maybe you could help with your experience. And they said, yes, okay, in that case, if I can be useful. And that's why I've accepted, and I'm very proud of Gavi. I think it's a great organization. I'm very proud to give some contribution to it. So I think, answering directly your question, what in my political experience was important was this idea of going beyond the national borders. And I really want to emphasize this point. We love our countries. I love also my country. I come from Portugal. We all love our countries, but we have to avoid the nationalism. As one very great author said, nationalism is the hate of others. Patriotism is the love of our colleagues and our country. Patriotism can be healthy, but extreme nationalism, so to go to see the others as an enemy, is extremely negative. And today, unfortunately, including in Europe, we are seeing rising nationalism. And so what I believe is important in my political experience, and in many others, of course, but since you asked about mine, is that I try to see things not just with the national eyes or glasses or of my own country, but I try to see things at European level, of course, but also as citizens of the global level. I know now some people don't like it. They say it's globalization and so on, but look, we are all members of the same human species. But when I make the case about human species and humanity, I always quote, I don't know if you know that great book of Dostoevsky, the Karamazov brothers. And there is a personage who says, my father liked mankind in general, but he hated every person in particular. So my point is, when you speak about mankind and humanity, it's not just an abstract, a statistical concept of mankind. Mankind is every man, every woman, every child. So this is the basis. More important than the country, more important than the party, more important than the states, is every person. And if we focus our action on the needs of specific persons, I think these are our fellow humans. So I think this is the important message to convey. And in a humanitarian organization like Gavi, that we don't make discrimination. We know that the world now is becoming geopolitically more fragmented, more polarized, more difficult. But my appeal to the leaders of the world, partly what I've been doing here in the Munich Security Conference, is okay, if you want to keep these agreements, I mean, I'm realistic, unfortunately, they are there. But let's at least, for some global public goods, like public health or fight against climate change, something that is global, that we cannot do separately, let's keep the cooperation, having in mind our mission. And the mission, in our case, the mission is to vaccinate the children of the world, but also in other cases, to look for the concerns of specific human beings.
Thank you so much. I really believe in humanity first. I always say that don't judge a person by what they are. Just see them as human first before looking at who they are, whether they are man, woman, or child. So thank you so much. I'm really grateful for what you and Gavi are doing, and I hope for more to come in terms of global health. Thank you so much, Dr. Barroso, for joining us today. We are really glad to have had you here in the studio.
My
Thank
pleasure.
you.
Thank you.